Alright, welcome back everyone. Dr. Ben, not a real doctor here. Today I am going to tell a quick story and then share how trigger points can cause dental pain. So about a week and a half ago now, I had we'll just say a unsettling Saturday evening in which I went to the emergency room to get checked out. Now, I don't go to emergency rooms. It's got to be something that's really concerning me before I go to an emergency room. I'm stubborn as a mule. So what happened was that I was starting to have some facial numbness, and then I had some burning going up around my eyes and then down the back of my neck, all the way down into my left arm. So my aunt died from a tooth abscess last year, so immediately my brain starts freaking out. With numbness and burning, I'm thinking nerves, I don't know what's going on, but I have a dentist appointment scheduled in a couple days, but I'm just not feeling warm and fuzzy enough about this where I'm willing to just let it ride out. So I decided to head over to the emergency room and go get checked out to make sure it's something that isn't, super serious. So using a combination of Wim Hof breathing to kind of settle myself down and to try and relax, by the time I get to the emergency room, things feel a lot better. But I'm still very concerned, and basically going through my medical history and a quick exam with the MD, who is basically the on-call dentist, they basically look at me like, what the hell are you doing here? You're fine. So I feel warm and fuzzier about it, but I don't feel a lot warm and fuzzier about it. They gave me a prescription for some antibiotics, which I went ahead and filled just to be safe. But I'm thinking that it'll at least, if there's something wrong, it'll get me to the dentist appointment, because a hygienist friend told me that without an x-ray, infections can go unseen. So I'm thinking maybe there's something going on that they didn't see because they did a quick exam, and I head off to the dentist a few days later. My dental exam, while they were very thorough and very polite and very helpful, it went pretty much like this. Ben, your teeth are perfect. We don't see any reason for the pain. While that's nice to know that there was absolutely nothing wrong with my teeth, it was also kind of unfortunate because there was still the concern about all the pain and the numbness. So I dug into my favorite trigger point reference manual, link below, the Trigger Point Therapy Manual, workbook, Trigger Point Therapy Workbook, by Claire Davies. And I started digging around. Now I know that when you have some neck tension, it can radiate to dental pain. Same thing with sinuses. If you have sinus problems, it can feel in your teeth like a dental problem. So I am going to share the principal major problem causers that lead to dental pain here real quick. And I'm going to start with number one, and this is from the Trigger Point Therapy Workbook. So first one is your sternocleidomastoid. Probably kind of hard to see with all this facial hair. So it runs up here from the corner of your jawbone down to your collarbone, and the other part of it runs down to your first rib behind the collarbone. So this is your primary problem causer. Trigger points here can refer up to above the eye, above or below the eye, up here above the ear, or even back here behind the ear. It can also cause problems with your temporomandibular joint. So this is the first one you want to focus on. It can cause referred trigger points into your masseter and also up into your temporalis, which are the next two that I'll talk about, and they also contribute to dental pain. The masseter is right here. This is your primary chewing muscle. This is what makes your jaw close and grinds up food. This one, trigger points on this can be extremely painful, and it can really cause a lot of problems with your, as I said before, your TMJ, your temporomandibular joint, and it can create some pretty intense dental problems. Well, not problems as much as pain, but problems. You get my drift. And then the last one is the temporalis. It's up here. It's kind of from your temple back here behind your ear. And it covers this whole section of the side of your head. It also helps with chewing and shifting your jaw. And that one will refer more to the front of the teeth along here. It can also create referred pain down into the lower jaw, as well as the masseter can do that as well. So first, let's talk about the SCM, or sternocleidomastoid. Admit it, it's kind of fun to say. Anywho, So this muscle runs down along basically the front of your neck. And the thing you have to watch out for working on this guy is major arteries running up along here. So you can feel in here, just to the side of your windpipe. It's hard to feel while talking, so give me a second. So right in here, you're gonna feel your pulse. Do not massage where you feel a pulse. Absolutely do not massage where you feel a pulse. Now, trigger points on this guy can run all the way up and down the muscle. And remember, there's two sections. There's one in front, and then if you come down here and it's easier to do it like this. Come down here, you'll see there's a second section that runs down, and this is the one that attaches to the first rib. So in order to make this easy on yourself, I'm gonna turn a little bit, and what you're gonna do is you're gonna look to the side you're massaging, and then you're gonna dip your head just a little bit down. That'll put some slack in this muscle here so you can get a hold of it. And all you're gonna do is you're gonna make a little C-clamp. And you're gonna find your tender spots, and what you're gonna do is just sort of slide down the muscle. And when you hit a trigger point on the SCM, you're gonna know it. It's gonna be pretty unpleasant, and it will refer to a lot of those places that I pointed out before. And you're just gonna do that all the way up and down the length of the muscle. Don't go too hard on this, especially when you're first starting out, because these SCMs will get quite sore. And right here, I'm feeling a little bit of a grain in the muscle. That's a trigger point. And you're just gonna slide down and massage that. All right, 6 to 12 strokes, and you're gonna do that multiple times throughout the day, 6 to 12 times a day. Again, straight out of the Trigger Therapy workbook. So to get to the back side, I find personally, you have the one head up front and then you have the one behind it. I find it's easier to start at the bottom and slide up. Now this guy on me is where I have the most problems. I have one particular trigger point I have been working on for a very long time, which is extremely painful to work. But again, same thing, make a little C, clamp the muscle, and slide down. And you're doing very, very short motions, 1/2 inch to 1 inch tops. And you can move up and down the entire length of the muscle to get that. Now for the masseter. The most problematic trigger point is gonna require you to work it from the inside of your mouth. You can do all of this. If you bite down, you can feel the muscle contract here on the side of your cheek. That is all your masseter. And trigger points on this guy can run the entire length across or up and down the muscle. So you're gonna have to explore a little bit and find where they are. The primary problem is gonna be access from inside your mouth. So you're gonna take your thumb and stick it in your cheek, and you're gonna pinch the muscle, and same thing, slide down. So I'm just gonna demonstrate, can't really talk while doing this. So just watch, and I'll show you how I do it here. So all I'm doing is pushing my thumb up against the side of the muscle and sliding down like this. Just from inside. Now, if you want to hit trigger points on the outside, I usually just cup my hand like this, find the spot, double up, and then just slide down. And there you go. That's the masseter. And then up here in the temporalis, again, clench your teeth. You can feel the muscle contract, and that'll give you an idea where this muscle is. Now for this one, you want to tilt your head a little bit to the side and let your head add weight as you massage. Again, support your fingers, make a little cup, 2 hands, and you're just gonna slide down. And again, on this one, the trigger points can be quite painful when you find them. Feel like a pretty good little knot of muscle. And you're gonna want to slide down real slow, because if you run over these trigger points fast, they're not gonna want to release. Just like this. For the masseter and temporalis, same 6 to 12 strokes, multiple 6 to 12 times a day. A little bit every now and again is better than trying to just beat the crap out of it and make it relax, because if you just beat the crap out of it, it's going to have a tendency to clench down and tighten up again and get even worse. So a little bit often is going to get more progress done than just beating the stuffing out of it. Now, you want to work on the SCMs first, because like I said, it causes satellite trigger points in your masseter and your temporalis. If you're working on your masseter or your temporalis and you get relief, and then the pain, the problem, the trigger point comes back, it's likely caused by the SCMs causing satellite trigger points. So you need to get these SCMs to release before you can usually make much progress in the masseters and the temporalis. The interesting thing about trigger points in the SCM is that you probably won't have any pain in this region, in the area of the SCMs, until you touch them. The funny thing about the SCMs is, even if they're all kinds of knotted up with trigger points, they won't hurt if you don't touch them, which can kind of lead you away from thinking that is the root cause. I've had some pretty severe headaches over the course of my life, and it is all related to this one trigger point in my SCM. That's from an old injury of landing on my head on a trampoline and almost paralyzing myself. So that one has taken quite a bit of time to make progress on. But anyway, those three muscles there are your primary culprits with dental pain. If you've been to a dentist, you have pain, and they haven't come up with anything, I would look at that. If you have pain in your teeth in general, that's a good place to look. It's something you can do on your own. Please, 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 don't be a knucklehead like me. Go to the dentist, get checked out regularly. I went 6 years in between appointments. Turned out it wasn't a big deal, but if there is a problem, they're gonna catch it a lot sooner if you're going every few months, rather than only when you have a problem. Anywho, like I said, I'll put the link for the trigger point therapy workbook down below. Honestly, just buy it. I don't think there's any book I've ever owned that I've looked at more. It is hands down my most useful resource of every book I own. Matter of fact, I have a digital copy on my phone so I can look at it whenever I want, so that's a great option too. Let me know what you think of these massage techniques. I use them pretty regularly to help myself out. I'd love to hear your thoughts on them and your experience. If you like the video, smash that thumbs up. If you know somebody who might benefit from it, share it with them. And if you haven't already subscribed, please consider subscribing. And until next time, be dental pain free and keep your life in motion.